For those of you that don't know these guys, I'm joined by Dr. Dave Paczkowski and Dr. Steve Derrington. If you guys want to just do a quick 60-second blurb about what you do. Steve, we'll start with you.
Sure. So I'm an osteopathic physician based in primarily San Diego, but I've got a clinic in Orange County as well. I do what's called interventional orthopedics. Basically, I use orthobiologics, meaning mostly PRP, platelet-rich plasma, as well as stem cells to treat orthopedic injuries without using steroids, without using surgery. So it's a very kind of comprehensive and really way to integrate with what our body wants to do to help us get back in the gym, being active with less pain. Social media stuff, I'm on Instagram and Facebook, SoCal Stem Cell Doc. And my practice that I work with, that I own, is HealthLink Medical Center. Website is healthlinkmedicalcenter.com. Should show up if you Google my name or the practice.
Nice. And Dave?
Yep, so I'm owner of Inside Out Strength and Performance and a physical therapist myself. So my wife and I own the clinic, and we work with active adults. We're in North County, San Diego, so Carlsbad area, and help active adults avoid surgery, get out of pain. I work with a lot of people primarily with overuse, some more chronic injuries, as well as some on the acute side of things. But as you can see from our gym, less like a normal physical therapy clinic you might picture when your mom or grandma might be going to PT, but we believe a lot in strength training and getting people moving and moving well.
Nice. Yeah. So there's a reason that I'm on here talking to these guys as doctors, very much respected from me personally, from the community at the gym. And it's so nice to be able to have people that are the doctors and the leaders of the medical world, like actually putting the right things out there. So before we get into all that and we turn this conversation into something different, last week, like I said, we talked the squat and the hinge, and really what we're looking at is a better understanding of anatomy in order to improve everyone's performance and prevent injuries. I think those are kind of like the two big ones, especially in the CrossFit space. So the push and pull. So if I'm just a big meathead and I'm going to Gold's Gym or 24-Hour Fitness or whatever, and I'm going to have my pushing day, right? I'm talking about doing like bench press and flies and shoulder press and Arnold presses. And then I might even like throw some narrow grip bench press and some skull crushers and all that kind of stuff in there. If we're talking pull, we're looking at our rows, our pull-ups, all that's the type of stuff. And what really happens is people are like, okay, I'm doing a push-up, I'm doing a bench press, I'm doing this, I'm doing that, but they're not actually sure what their body is supposed to be doing. They understand how to do the movement. I think this is really apparent, especially in the CrossFit space where people don't have maybe a bodybuilding or anatomy background of any sort, and they just get taught how to move, which is great because we teach movement versus training muscle group. But there's a big disconnect there. Like if you're doing a push-up and you don't understand that the muscles on the front half of your body are supposed to be the big movers there, that's where we start to see people ending up doing push-ups that look like this and start to end up with some of those injuries and stuff. So I'm going to kick it to Steve to start, and we're going to start on the pushing side, talking about our big movers for our bench press, our push-ups, our handstand push-ups, push press, all that sort of stuff.
Cool. Thanks, Casey. So like you said, kind of the movements that people are usually doing when they're doing their push workouts. Peel layer off. Let me do that. So actually, yeah, so there's kind of two main muscles that we're going to talk about on the front. Pecs here, we got pec major. And then as I kind of minimize that, you can see deep to that pec minor. The reason I kind of highlight both of those is because they attach different places. The pec major attaches in the sternum, right in the middle of your chest. If we can get rid of that, you can see it attaches all through our collarbone on the top, and then it actually attaches onto our humerus, or our main arm bone. If we peel away and we see pec minor, that actually attaches on a little bony prominence that is part of our shoulder blade. So that attaches a different place, has a different kind of functional movement, but Some different mechanics from the two of those, but both important pressing muscles. And then as we look next, I mean, most people are going to think of their deltoid. We're talking about pushing, whether that's bench press or shoulder press. And that muscle is called the deltoid. As we again peel this away, you can see that that muscle attaches on the collarbone, on some of the parts of that shoulder blade that we're talking about, wrapping around all the way to the back. And depending on which direction you're moving, the front, lateral, or the posterior, so anterior, middle, and posterior parts of that deltoid are going to work differently depending on if you're pushing forward. It's going to be more of the anterior fibers. Pushing more lateral, it's going to be more of the lateral fibers. And then posterior is going to be more for actually potentially pulling movements. And then the next muscle we're talking about is the tricep, which not surprisingly has three different parts to it. We've got this one here, lateral head that attaches again on the arm or the humerus, that bone there. This one here attaches on a different spot on that shoulder blade. And then as we get rid of a couple of these, you can see this one here that attaches on the humerus as well. And this one this tricep attaches down past the elbow joint. So that's going to have some different movements that Dave will get into. But you can see all these muscles are about pushing, but they start different places, they attach different places on different bones, and they cross several different joints. So that's a complex movement that we're trying to accomplish there that takes several different pieces.
Cool. And then going to get into some of the movement applications of this. So as you can see, and a nice segue from Steve of showing where some of those different muscles attach, even though pushing is occurring in this forward motion, which you feel in the front, they're going to attach to different places, different muscles are going to be involved. But to kind of simplify things, to break down some of those big muscles we're talking about, so pecs, delts, triceps, looking at things as an easy way to picture it is even things as subtle as hand placement can affect what muscles specifically are the ones working. So if we think something like push-up, bench press, getting wider out, so wider stance in our wider grip in our push-up and our bench press, we're going to be targeting a little more of pecs and less of something like triceps versus, so Casey's reference to the bodybuilders, they will target their triceps by bringing in a closer grip. Diamond push-ups is a more familiar way to do that as well. And things that are in tight are still going to be working the pecs. We're never taking any of these muscles all the way out of it, but bringing in that grip narrower will isolate a little more of the triceps. So that's something as subtle as grip. And same thing would be applied in essence through something like an overhead press too. We're focusing more on the forward pressing motion, but same thing when we're talking overhead press, we're taking a little bit of pec out of it and getting a little more delt tricep focus. So what does that mean? Knowing that is knowing where you're weak within a given motion. So looking at not just grip placement, but where you're missing a lift, where you're having trouble with, say, push-up, overhead press, handstand push-up. If you're having trouble on that lockout, so you're strong off your chest, you get to that last degree of motion, you're from here, you're having trouble locking out, that's when you usually need help. That end part of the motion is stressing a little more the triceps compared to something like pecs or delts. So knowing this should guide where some accessory work should be. And like Casey mentioned at the beginning of this, accessory work isn't a bad thing and isn't limited to just bodybuilders. It's something that a lot of CrossFit athletes could benefit from more of if they know specifically what areas need to be addressed. So by knowing that, hey, I struggle on this last piece of my lockout, or I get to this point in my handstand push-up overhead press and I can't finish the lockout, some accessory work of some more tricep work, some close grip stuff can be a good supplement to that. Versus on the other end of it, if you always get stuck in the bottom, coming up from a push-up, you're doing something and it just pretty much sticks to your chest, then a little more chest work is going to be beneficial in that case. And there's different accessory things but something as subtle as adjusting your grip, then strengthening a little more in the wider position can help you work through some of those sticking points.
There we go. I was new at this today. So yeah, great stuff and great points on all that. And I just want to kind of add in, I think one of the big things for me as a coach that spends the majority of my time with the average population, that's just looking to stay healthy, stay fit, but at the same time, everybody wants to improve. Everybody wants to get better. Like once you have an understanding of where you're weak, it's way easier to fix it. But it's like the coach telling you like, you're doing it wrong, you're doing it wrong, you're doing it wrong. And like, you don't understand. But as soon as the coach is like, hey, as you squat, pull your knees out, and you're like, oh, it's so much easier. It's the same thing. Like if, like Dave was saying, if you're missing your lockout on your shoulder press, on your push press, on your push jerk, on your handstand push-ups and your dips, and that's where you get no rep all the time and you can't quite get it. If you can start to understand, or if your coach can understand like, oh, you need more tricep work, now you in a sense just made your workouts that much more efficient, and you're able to increase your performance. And we'll get into some of this later, but now you're also going to be moving in the way that your body's designed, so you're not going to overload some of the other the muscle groups that are going to end up being injured for doing the work that they're not actually supposed to be doing. So Steve, let's kick to the other side and let's talk pulling muscles. So, and I tried to get Dave to just do bicep curls the whole time, but he didn't want to demo that. I guess he didn't want to show everything off. So
just fatigued too many curls this morning, Casey.
All right, fair enough. So Steve, go ahead and hit pull-ups, any pulling movement. You can kind of talk through that.
Sure. So yeah, like you said, it's really anything that you're pulling where you're taking your arms from further away, closer to your body. That's going to be really any kind of pulling movement. So that could be a lat pull downs from overhead. It could be a bent over a row. Obviously, pull-ups and all the different pull-up variations, muscle ups. These are all going to be where you're taking your arms from further away, bringing them closer to your body. One of the main muscles that people like to work on are the lats. And as we kind of fade some other areas here, you can see it attaches here at your arm, that humerus bone again. Different spot than some of the other muscles we talked about, but still attaches there. So that's going to be moving your arm. And you can see this broad kind of yellow area as it's highlighted, where this attaches throughout your thoracic spine, throughout your lumbar spine, onto your pelvis, the back of your kind of hip bone, and all the way down here through your sacrum. So big, broad attachments there, big, strong muscle, and attaches here at your arm there. So that's going to be one of our main muscles. As people get bodybuilding, I mean, that's a big one that kind of gives you a nice broad, kind of the wings underneath your arms. So that's one big muscle. Another one is going to be the traps. And again, the traps, just like the deltoids, has different parts to it. If you kind of look here, you can see fibers running from the side towards the neck that are kind of going upward. That's more the upper traps. The ones that are going straight towards the middle, that's the middle traps. And then the lower traps are the ones that are kind of angling down. Same kind of thing, where as we try to isolate and get rid of some other stuff, you see that attaches throughout the cervical spine, attaches throughout the collarbone there on the side, and at different places on the shoulder blade or the scapula. And then again, all throughout the thoracic, even into the lumbar spine, for where it attaches in the middle there. And that is going to be a big one that's going to pull things obviously from further away towards your body, like I was saying. And then we kind of get into what most people would say, oh, it's the biceps. But there's lots of different bicep muscles. There's lots of different muscles that will work kind of on this front part of your arm. You can see the long head of this muscle here that actually, you see the little skinny part that goes up into the shoulder. That's where people end up getting labral problems, where that biceps tendon attaches way up in the shoulder joint. There's another one here that attaches on part of the shoulder blade again, right up there at that spot. And as we hide that muscle, you see there's another small muscle that attaches that same spot that attaches to the arm. And as we show this one here, brachialis is another one that's going to do a similar kind of pulling motion from the arm and from the elbow. And we got to add some muscles in here. And then this last one here is one that actually crosses more the forearm. But if you flex your arm, you can kind of see it popping up from the kind of front part of your elbow as you flex your arm. But these are all going to be important in being able to utilize them for that pulling motion that you're trying to accomplish. That you might think it's all these big, huge back muscles, but the bicep, just opposite of what the tricep does on pushing, is going to be very important as well.
Cool, thanks, Steve. And so movement application in terms of that, this one, and we'll break down a couple key points here, maybe not quite as straightforward at face value as something like the bench and the push-ups are really easy to see. So widen your grip, more chest, narrow your grip, more triceps. Because there's not a lot of like straight rowing, like a bent over barbell row, you can adjust your grip the same way, but that's not a movement that's seen as much in something as it relates to CrossFit. But looking at a couple examples of something like our pull-ups is a good way to see the difference in that. So pull-ups versus chin-ups. So pull-ups being palm facing out away from you, chin-ups being rotated this way. A lot of people have an easier time with chin-ups because it's a little more of that elbow motion, can recruit a little more biceps, and people tend to pull themselves forward a little bit and have an easier time getting up because they actually recruit a little bit of their chest as well, which in the short term will accomplish the motion. But in terms of what that's telling us is usually if that's an easier motion, you find yourself at the top of the pull-up looking like this, with those shoulders pulled forward. That's telling us that some of those trap muscles, especially the middle lower parts, and those lat muscles aren't helping to pull you into this strong pull back position at the top, which might be why something like a wide grip pull up would be more challenging for people, and talking strict variations for this. So that's something to note, how your finish position is, as well as if you have a hard time, if you can't go really wide and do strict pull ups that way, and chin ups are a lot easier. That's one thing that where more focused lat work can be beneficial. Other thing to take note of is as it relates to the kit. So if you're getting early arm bend, if you find, or in a muscle up something, if you're having a hard time with that straight arm pull from the kipping position as you pull with straight arms, that can be another thing to say that the lats probably aren't helping you out as much as you want. If you, and this is where it comes to have a coach that can see these things becomes super valuable, or videotaping, as we talked about in our last seminar as well. But if you're getting a very early arm bend and trying to pull with your biceps, that's going to create more inefficiencies in the movement and can be linked back to mechanics. Some of it's just a matter of knowing what you're doing, but if it's, it can be a strength issue as well too, if you're having trouble with that straight arm pulling motion. Now, as this relates to things like on the rower or something, so think of the traps and lats. Simply speaking, trap's going to do more hiking up, lat's going to do more pulling down. So if you're on the rower, and it's going to affect you with, if you find yourself, again, shrugging up, if you're pulling and shrugging up, those shoulders getting close to their ears, if your upper shoulders feel tight after rowing, if you get any neck tightness, headaches, anything like that after rowing, that's another thing that's going to clue us in on maybe some more lat work would be beneficial. Even the lats, where Steve showed the attachments that they go to the lower back, these are big powerhouse muscles that create some low back stability too. So if you're missing that strong pull on the rower, it can affect the lower back as well, because you're going to have to arch from the back to make up for what the lats aren't doing. So the lats become super important, and most people, I'd say the majority of people, either can have strength or missing strength there, or don't know how to properly use them, are sort of the two categories that people fall into, and both are going to affect performance. You're not going to be able to have as strong of a pull, but also set you up for shoulder issues, neck issues, low back issues can all be at play with that.
I don't know how I keep getting muted. It's like somebody's pushing the button. But so anyway, so basically same basic idea from the pulling side to the pushing side. You guys should be starting to see a lot of similarities. If anybody watched the one last week from the squat and hinge, we're looking at the same basic thing. Like the best way it was ever explained to me is that your shoulders are essentially your hips just flipped upside down, and vice versa. Obviously there's some differences there, but like for a real base understanding, your shoulders and your hips work roughly in the same fashion. You have that push and pull on either side. But I think one of the key things, and Dave, you kind of touched on it right there at the very end, is that sequencing of movement. When you have somebody in the gym and they're being injured over and over again, or they're really struggling to learn movements, in CrossFit, we talk a lot about core to extremity, using big muscle groups before we use our small muscle groups. The way that Steve laid the muscle groups out was essentially from your big movers to your smaller movers. Your lats are going to be stronger than your biceps. And just so people can kind of wrap their head around this and like imagine themselves or their clients in the gym, if you have somebody on a pull-up bar and they always have elbow pain, or even on the rower, watch them do their pull-up really closely. The sequencing of the movement, before anything else happens, you'll see the elbow bend, and then everything else starts to go. And now all of a sudden, that initial elbow pull was putting all of the load on this joint here. So we're out of sequence and things start to go really bad. And we'll start to talk, I'm sure, about the injury stuff. But I just want you guys to understand the importance of why we're talking anatomy and why we're telling you, like, these are your lats, these are your traps, these are your deltoids, these are your biceps. Because once you understand it, now all of a sudden, not only do you prevent injury, but you also teach yourself to move in the strongest and most efficient way possible. So before we get into injuries, I guess we should probably talk about all of those little small muscle groups. So what do you got, Steve?
So the first one that we need to talk about is going to be the rotator cuff. A lot of people are familiar with that in name, at least. They may not understand exactly what that is. So we've been kind of looking at mostly big muscles here, but let's peel some stuff away. And we're going to see the rotator cuff is actually a series of tendons. And what usually happens is it's a series of muscles. And what usually happens is that tendon attachment is what ends up getting injured. This is one of our rotator cuff muscles, which is the red part, and the small little yellow is the tendon. That's called the supraspinatus. That's one that oftentimes gets impinged underneath this part of the scapula or the shoulder blade right up there. We've also got something called the infraspinatus that is right underneath this spine of the scapula, which is that kind of green part you're seeing. You've also got the teres minor that's just below it. And then on the front part, you've got the subscapularis, which, as we kind of hide the other ones here, you see that's on the front part of the shoulder blade and attaches on the inside part of the humerus. That biceps tendon runs right in the middle. And then just next to that is going to be the supraspinatus, infraspinatus, and teres minor as you kind of work your way around. Now in med school, I'm sure in PT school, you guys talk about how these muscles and how that rotator cuff is doing movement. Bring your arm out to the side, bringing your arm in, bringing your arm doing more something called external rotation. And those are kind of those are smaller components of what these muscles and their tendons do. Really what they do, more importantly, is keeping this head of the humerus in appropriate relationship to the glenoid, which is the kind of the T part of the ball and T, if you want to think of that joint like that, and holds that in the right relationship to that. So as those muscles are trying to hold things in place while these big, huge muscles are trying to accomplish movements, it's important to have those rotator cuff tendons dialed in so they can keep your shoulder in a healthy position so you can do those movements over and over and over, high reps, without getting injured.
Yeah, thanks, Steve. And so movement side of things, this isn't going to be quite as in-depth as some of the other ones because these shouldn't be your prime movers with a lot of these movements, at least specifically in CrossFit, where we see a lot of overhead athletes, if they're doing a lot of throwing, the cocky motion and controlling the throwing part is where in athletes tend to see some of the issues, but that doesn't make CrossFitters or lifters any more immune to it. Just as the majority of people I see with shoulder problems are anyone doing any kind of overhead stuff. So whether that's high rep, pushing, pressing, Olympic lifting, any of these things can put you at risk for it and there's a reason we started with those big muscles first. If you're missing good lat, trap, pressing, that whole sequencing that Casey was talking about, and these muscles are trying to work to do all the work, you're going to have some problems. But as I'm going to elaborate a little more after we talk through some of the other muscles around the shoulder blade, but positioning becomes everything. I mean, as you go up overhead, how well are those muscles sequencing to stabilize that? What position is your shoulder in? This is going to stress the rotator cuff completely differently than being able to stay pulled back, stay engaged, and stay in these good positions. So we'll elaborate here in a few minutes as we get into the shoulder blade scapular piece of that as well, as it'll help tie everything together. But the position becomes everything. I'll elaborate on that in a few minutes here.
Yeah, and Steve, before you jump in, and just kind of to reinforce what we're talking, so we talked kind of like this push and pull at the beginning, and now we're kind of looking at all these smaller movers. And just so everybody's has a clear understanding, like what we're looking at is essentially all the muscles that are going to stabilize as you're pushing and pulling. Like, yes, they have some action on the joints, but their big role there is to stabilize so your big movers can actually do what they're supposed to do. And Steve, if you want to add anything on that, feel free, and you can kind of go into the next piece that you were going to hit.
Yeah, I mean, I think that's a super important part. And like we said, we kind of went from the big, exciting, like, here's the movements, but you got to break it down and be able to be in the right position and have that right control so you can do those movements correctly. Because like I was showing on the rotator cuff, that's a pretty small area where that supraspinatus tendon runs through. And as Dave was kind of showing, as your shoulder blade slides more forward, you're gonna what's called impinge. You're gonna irritate that tendon underneath that space, and you can get what people call a bursitis a lot of times, or a tendonitis. It's not usually what the problem is. Usually it's the tendon itself that's getting basically worn on and rubbed on, and gets that's where you can get tendinosis, even partial tears, even full tears. Usually it's an accumulation of lots and lots of repetitions, whether it's someone who's athletic or whether it's someone who just sits at a computer desk all day long and has their shoulders slouched forward and in that bad position, and just kind of chronically just slowly rubbing on that. So that posture piece, which we'll come back to, and good coaches, whatever athletic event you're doing, are going to harp on that position, because that's super important to keep you healthy, as well as allow you to perform really well. So we've talked about the scapula, the shoulder blade, quite a bit already. I've talked about a number of different muscles that attach onto there. You can see kind of a funny shape to different places of it, which are places where muscles, tendons, ligaments attach to it. We've talked about a number of the muscles that attach, but there's actually 18 different muscles, which is kind of crazy. Lots of different places. The rotator cuff tendons, the biceps, the triceps, the different bicep, the smaller muscles like coracobrachialis will attach there. There's all these different ones here that are going to move your shoulder blade either up or down, or at least move the glenoid up or down. And there's muscles like the levator scapula, rhomboids. We got different parts of the rhomboids, major and minor. You got serratus posterior. You've got, we can get to the front side here, serratus anterior, which is going to be an important one that attaches. You can see all these different kind of finger-like projections. Those are places where that muscle attaches on the ribs, but then it starts way up here on the inside part of the shoulder blade. So that's going to be an important muscle. And if you have good programming before you're doing lots of pushing and pulling, you're going to be doing scap push-ups, scap pull-ups to really warm that muscle up, get it ready to activate, to hold and pin that shoulder blade down against the rib cage, so you can have that nice stable base. So again, those big muscles can move you. I think those are the main ones. I mean, there's lots of other small ones, but the big ones that are going to help keep you in good position there are the ones we've talked about already, and these kind of smaller, newer ones, serratus and rhomboids and levator scapula, which I don't know if Dave has any thoughts on levator scapula, but that's one that almost any person, you can stick your finger in that muscle belly and it's going to be tender. It's one that a lot of times, just because of our daily lives, doing a lot of work where we are, sitting at a desk, or we're not doing, things in a good upright, position, that ends up getting overworked, just like a lot of other muscles. And you get that forward posture there that just predisposes you to so many problems. And, as much as you can do great work when you're in the gym for that, 1 hour, or even if you are in for hours a day, most of the time you're going to be sitting watching TV, you're going to be sitting at your job, at your desk, writing, typing, doing whatever, and you're just reinforcing that abnormal position that you need to work on, outside of just that 1 hour, really, really focusing on, hey, here's my athletic part of the day, here's where I'm doing my exercises. But that good posture and positioning, you've got to kind of build that and reinforce that pattern on how to do that so you can position yourself to stay healthy outside, but again, so you can perform well when you're actually in the gym.
Cool, thanks, Steve. And moving side of that, tying a lot of this together, and we're harping on a lot because it's that important, the position. So we think, so forward, we have our forward posture, and we have everything stacked in good alignment. And that forward posture is going to be what causes a lot of these problems that we see so often. So the impingement, the rotator cuff problems, the labral problems, the bursa problems, the arthritis in the shoulder joints, any of those things, if you've been told you've had any of those things, it's not rotator cuff problem is not a problem with your rotator cuff. It's a problem with how everything is sequencing and how your movement is all working together. So it's not that you have a bad rotator cuff or often even a weak rotator cuff. Your rotator cuff's just so ticked off because it's working all the time because you have other areas not helping. Or if you're always trying to push and pull from this forward position, then your rotator cuff's overstretched. You're not in the proper, what we call length tension relationship for the muscle to work appropriately. So it's you're way overstretched, and then you're trying to fire this muscle, and it's causing these problems. It's pulling everything forward. It's stressing the joint. So position becomes everything. It's a little more complicated than just being forward or back, but in general, if you find yourself always in this position, this tends to be where a lot of our problems happen, just with society, with our programming and those things. So getting everything pulled back and working together is a very simple way to think about pulling back, is a simple way to think about getting your shoulder in a slightly better position and getting some of those other muscles to help out.
Nice. All right, so that's kind of like our basic overview, hits all the science and kind of ties in some of the movement stuff. So one of the things that I want to make sure we touch on, and I'd love to have you guys kind of throw some input in there as well. And there was a question that popped up from Lindsay, and we'll get to that after, just so if she's listening, she doesn't think I forgot about her. But so we're talking about a push, a pull, and then we have all these little stabilizer muscles. Like, for those of you that don't really care what the name of the muscles are, like, totally fine. But what you want to understand is if your program is doing what it's supposed to be doing, if your coach is doing what they're supposed to be doing, you should be working in perfect balance. When we are balanced from front to back, push to pull, up and down, that is when we are going to be able to function at our optimal level. So when you guys are training, if you feel like every day you're pushing way more than you're pulling, or vice versa, you're pulling way more than you're pushing, or you only pull in a vertical plane, like say like a pull up, but all of your pushing becomes in a horizontal plane, there's some things that are going to get put off by that. So when you look at programming as a whole, like, it looks like, especially in the CrossFit world, it looks very randomized. And I will be the first to tell you that a lot of CrossFit programs are completely random, but it doesn't mean that that's the way that it's supposed to be done. Like, varied is different than random. And for our program at CrossFit 760, I put a lot of time and thought not only into like what the meat and potatoes of the workout is that day, but what we do for the warm up, what we do for our accessory work, what the meat and potatoes is, what the cool down is, and not just for that day. Like, if people really look closely, they'll see warm up movements from the first part of the week that all of a sudden become maybe some more technical movements that are in the conditioning. So we start to build that movement pattern through the day, or we start to do some prehab work in a sense for our overhead squats that are going to happen the next day in our cool down the day before. And that's the beauty of this. Like, if you start to understand that my lats do this and my biceps do that and my pecs do this and my deltoids do that and my traps do this, now all of a sudden when you program, cool, I know that if I did a whole bunch of cleans one day, I should probably have some sort, I'm doing cleans, so I'm shrugging over and over again. Like, we're just talking upper body. Yes, there's some stabilizing and stuff going on, but that movement, especially in high volume, will start to crush you. Now, then you end up looking like me, where we walk around all day like this. What should be happening at some point in the next couple days is some sort of shoulder depression, where we're doing dips and we're starting to push ourselves back down into that other position. We start to get the balance there. So I think as you guys start to take more control and more responsibility for your own training, understanding the anatomy is mandatory. Whether you want to program for yourself or not, but just being in the gym, having that understanding, and you'll start to recognize what a good gym is and what a good gym isn't, or if your coach is actually doing what they're supposed to be doing. Thoughts on that, guys?
Yeah, I mean, 100%. I think I talked about this before, Casey. We've had discussions on this, but like you mentioned, smart programming is going to have things build throughout the day and also within the day. So, like I mentioned when I was talking about the serratus anterior, doing those serratus push-ups or push-up plus, some people will call it, or doing the pull-up with the scap pull-ups. I mean, those things are going to be important and paramount for you to be able to, one, perform, but also, like you said, stay healthy where you can do those things. And I'd love it if a bunch of people kept going to CrossFit gyms that didn't do a good job programming, and I'd be full with people, because they'd be getting injured all the time. But I'd much rather people have good programming and can stay, strong and healthy and keep active. And, when things happen, which they're still going to, no matter what you're doing active wise, they can still come see me. But, it's a lot better if you can align yourself, people that know what they're doing and can do that training where you have a balance and a kind of a stepwise progression of that programming, that you can benefit from. And if you have the time and the ability and the knowledge to do that yourself, by all means do that. But otherwise, I think if you're going to be doing any kind of activities, I think you probably do need some kind of direction from somebody who knows what they're doing.
Yeah, in case a couple of things that, as you're talking to, that you pointed out that become important is that, so there's the balance of movements within the program. There's also the balance of, so how well comparing strength of some of your different movements from some of these opposing patterns is where you can start to piece together where some of your weak links are and where those imbalances are that can eventually cause some of those other problems in either performance or in injury. So specifically, if you can strict press, say you can strict press 200 pounds, but you can only do, so you want your opposing group, so that would be the pulling lats strict pull up, to be, and not it's going to be equally as strong, because there are some natural ratios that it'll tend to follow. But if you can overhead press 200 pounds, you should be able to do, easily 5 to 10 strict pull-ups, depending on how much you weigh and everything. But if you're overhead pressing that much and you can't do any strict pull-ups, or have to do all your pull-ups kipping, that's a sign for some of those imbalances. Same thing if you can bench press 300 pounds, but for a bent over row or a dumbbell row, you're doing 50 to 100 pounds. That's a little exaggeration, but those are things to pay attention to that are gonna, if they're not creating problems now, are gonna potentially create problems long term. And then, like Casey's saying, this becomes important too with knowing what muscles are supposed to be working, because in his dip example, a lot of people, while we're doing a bunch of shrugging, we want to counter that with something with depression. A lot of people are doing their dips, finishing up here, and then wonder why their shoulders are always sore, why they're not getting the desired effect. The programming can be efficient, but that takes some responsibility on you to know, okay, this is a better position, this is what's going to counteract that, than just simply assuming that that's going to take care of itself.
Yeah, nice, guys. And I think to piggyback on that, I think that is probably the big one, is like when people are moving, especially in CrossFit, and they're trying to go so fast that all they're worried about is getting the work done rather than moving well. And like, yeah, I get it. Like training movement patterns is really, really important, but it only works if you're training the movement pattern properly. Like just because you got the work done is not like the end all be all in the gym. Now, if you're hanging from a cliff or a building for your life and you use more bicep and trap and chest to pull yourself up and save your life, like bravo, like you win. But if you're doing it in the gym every single day, like you're missing the point. You're missing the intended stimulus not just of the workout, but of the movement in general. So if you guys are doing pull-ups and at the next day your biceps are sore, but you feel nothing in your back, that's a cue for you to take a step back and go, I need to reassess my movement pattern. If you get done doing 100 push-ups and all you feel the next day is your traps, there's something going on there, something for you to look at. And I'm super guilty of this. Like if you look at my posture is awful from my background. Like my shoulders are rolled forward. My triceps have pretty much been turned off for the majority of my life. I do most of my pushing with my chest, and I have very little tricep that works. And I think most of my lats probably take over, and that's why they're so big. But once I finally started to straighten it out and I started to get my shoulders pulled down and back into that good position, I started to get all those little accessory muscles that we've been talking about to start firing. I would do push-up workouts and I would feel nothing in my chest, and it would be all triceps because my triceps were actually working for the first time in years. And that's the stuff that we want you guys to be able to get right away and not have to wait 20 years into training to figure it out. Like, it took a long time to get there. So hopefully you guys can learn from some of our experience. Do you guys have anything to throw in on that? And then we'll answer a couple questions.
Well, I think your point about things that you struggle with and where your weaknesses are. I mean, some people might think that, oh, people that do this a lot, have been doing it for a long time, do it professionally, do it whatever, like they've got it figured out. It's easy. I'll never get there. I mean, that's just not reality at all. I mean, as you know, Casey, you harp on me in a lot of things that I do, and I've got mobility limitations. I got some strength limitations, and those are things you have to just keep working on. And you do your best to put yourself in the right position with all the things we're harping on. But it's a constant effort for everybody. So don't get discouraged, keep at it, and just keep working at it. And like you said, in case you were saying, when you make some changes, you start feeling certain muscles turn on because you're reinforcing that good pattern. But it's something that it'll come. It just takes time, it takes patience, and it takes persistence.
Nice. Yeah, I love that, Steve. And don't beat yourself up over it. Work towards improvement, not having it perfected. There's very, very few, as in zero perfect movers out there. There's always something that can be worked on, and that's a good thing. That doesn't mean because you have some of these imbalances that you can't train smartly, you can't train effectively, you can't get results, and you can't even be pain-free as long as you're aware of those things. But knowing when to attack these things from what Casey described more called rehab side of things, of taking a step back, getting everything in a good position versus when to just get stronger. And that's a common thing that I tend to see with people in here is people fall on one end of the spectrum of you get the bodybuilder Gold's Gym guy we talked about of plenty of chest and tricep activation, but the prehab side of stuff would be more beneficial to take a step back from some of that strength work and strengthen those muscles. Now, however, that's not everyone. There's a lot of people that don't need the stabilizer work. Their shoulder hurts, so they go start doing all these correctives, which we're a fan of correctives. We do a lot of them with the people we're working with, but they're not always warranted. If you hurt your shoulder, that doesn't mean you have to just go do crossover symmetry, stop pressing, doing a bunch of sideline rotator cuff strengthening exercises with a soup can or something. That's not always the answer. Sometimes you need more chest, you need more lats, you need more of that sequencing we're talking about. And now, if you can work through that on your own, you're going to save yourself some money probably from having to see some of us. But if you want to save yourself time and frustration too, finding someone who knows what they're doing can help speed that process along quite a bit. So either being aware of it and trying to work through it on your own, but if you're running into frustrations with that, finding someone that can help you through it.
Nice. All right. So before we get into their questions, I have a question for you guys. 60 seconds or less, your thoughts on kipping pull-ups. So coming from two doctors. So Steve, thoughts on kipping pull-ups, 60 seconds.
I like them. I think there probably is a limitation depending on your injury history and depending on some of your mobility and your strength. You got to be careful with them because they can obviously, you can fry your shoulders, you can injure your labrum, you can injure your bicep, you can injure your rotator cuff. So you have to make sure if you're going to build up to those kind of complex movements, you have to have that foundation really locked in so you can keep your shoulders healthy. And some people, depending on some of your limitations, you may not be able to do them, and that's fine. But I think if you're going to do those kind of complex movements, then you've got to make sure that you're just dialed in.
Nice. Dave?
Yeah, I mean, I think you should have strict pull-ups before you have kipping pull-ups. Personally, I think if you can't do a movement slow and controlled, I don't think you should be adding speed to it, because that's when things are going to break down even further, and that's where the muscles that are supposed to be working stop working. We get those joint issues and those things that people come and see us for.
Nice. All right. So we're in a point right now where everybody's basically working out at home or limited equipment. And Dave, Lindsay asked, just for those training from home currently with limited equipment, what are a few of your favorite lat focused body weight exercises, and adequately promote proper recruitment? So that's an awesome question. And I actually was just having this conversation with some people yesterday or the day before. And that's the hardest one. Like right now we're programming at home workouts with kettlebells, dumbbells, medicine balls. Most people don't have access to a pull-up bar or really anything to do any, like, especially vertical pulls, but even horizontal pull stuff. So for me, we've been using a lot of croc rows, dumbbell bent row, stuff like that, even some like high pull or upright row type of stuff. So not all directly to the lat, but at least we're pulling in some fashion. And I actually just saw a really cool video come up on, I think CrossFit Training put it out on social media, basically like how to make almost like a homemade TRX strap out of a sheet and a door. So basically, like, imagine a big giant bed sheet. You tie a big knot in one end of the bed sheet, so it's like all compact. You take that end of the knot and you put it on the side of the door, like basically, so that would be on the side where the door is like pushing open towards. That knot's there. You take the sheet and you put it as flat as possible through the top of the door. You close the door, and now you have this rest of the sheet, and you open the sheet up, and now you have something that you can hold on to that you can essentially do ring rows or like TRX style rows and stuff with. So I haven't played around with it yet, but it seems like a really cool option. Everybody's got a door, everybody's got a bed sheet. So I'd love to hear your guys' thoughts on movements for lat activation stuff with minimal equipment.
You want me to go, Steve?
Yeah,
Yeah.
go for it.
Rows are going to be great. Yeah, anything you do with rows. You can get creative if your table's sturdy enough. You can do what we call like an inverted row and pulling yourself up that way, even if you have no equipment. We do a ton of band work. If you can get a pair of bands, there's a ton of lat and all sorts of lat and shoulder work that you can be doing with those. We love band use. Sorry, this guy with his loud Mustang started. Hopefully it's not bothering you guys. But so one of our favorite ones here too for minimal equipment. So it's not our strict pull-up series here, but using something, broomstick, anything like that, and then adding a partner, so using some manual resistance stuff. This can simulate the pull-up pretty well. So you're adding resistance, they're able to simulate that pull. You can work on sequencing with this. You can change the lower body position for some different ways to go about it. But this is one that popped in my mind too that we recommend for people that are trying to strengthen the pull-up without needing any equipment really. And you can even do this holding onto their hands or holding on to anything really that would work for that. You can adjust the resistance to what they need with something like that, so that we recommend these even if people have access to a gym, because you can add more resistance where they're stronger and take off a little resistance in their weak points of the range of motion.
That's awesome. I love it. What about you, Steve?
Yeah, I mean, I think we were talking about that, Casey, a couple of days ago, and it's hard. I've been kind of looking around my house and seeing, like, are there any doorways that have a big enough frame, or what's my roof like, or just something that I can kind of hang from and pull up from. But yeah, I think that the croc rows and different rows and high pulls are kind of the best you can do with the situation, and just making sure that you can obviously, we talked a little bit about kind of programming, but with weight, speed, volume, I mean, you can modify, or you can kind of train lots of different ways. So if you can make sure that that scapular position, that scapular pull, and the shoulder blade, just basically keeping it where it's supposed to be as best you can with the exercises that you have access to, use that as best you can. And then when you get back in, hopefully you haven't fell off too much from where you were before, when you're able to do actually a lot of barbell or ring work.
Nice. Yeah, I completely agree. If you guys have any other questions, go ahead and post them up, and then we're going to wrap up if we don't get any questions. But if you're going to ask me, like, what can I do to get my lats strong while I'm in quarantine? Here's my answer to you, and you might not like it. Do a whole bunch of T's and W's and Y's and all that good stuff, and then wrestle with someone. Just wrestle every day. You'll get huge lats, I promise. So find somebody to wrestle. If you don't have anybody to wrestle, get a dog. Go wrestle a bear, something like that. That's my answer for you to make your lats strong until you get back on a pull-up bar. If I don't see any other questions come in, I'm curious from you guys on pull-up bar specifically. Pull-up bar, close grip or open grip, and why?
Go ahead, Dave.
Yeah, I'm a fan of both. I think changing up your grip specifically. So one, the open grip tends to, I like that for some reasons of it is very functional. If we take things, I mean, not like everyone's going rock climbing every day or those things, but most of the time you're not going to, if you're out somewhere climbing a tree, climbing something, you're not going to always be able to fully wrap around. So there is some functionality behind that. But the reason like the thumb over grip too is there's a big connection between our grip. So when we talk sequencing, there's a big connection between our grip and our shoulder function. And that's a long segue that I won't get into today, but just pretty much know the grip and the shoulder work very closely together. So by giving that full thumb wrap grip too, you can help with even engaging some more of the rotator cuff and some of those other muscles as well.
Yeah, I mean, I think I sometimes go back and forth, just kind of depending on what I'm feeling like at that day. But I think that thumb over grip is going to be a stronger position for you. Like Dave was talking about, getting grip strength. I mean, as you can incorporate that different grip versus just coming over the top, you're just going to be able to hold on to the bar a whole lot longer. So your arms aren't going to fatigue as fast. Your forearms aren't going to fatigue as fast, and you can actually, work the big muscles you're trying to work rather than having to be limited by the ability just to stay up there.
Nice. Yeah, I'm always curious on what people think. I teach the close grip, especially kipping for safety reasons. But I definitely have found with my shoulder stuff that the more I go into that close grip, the more it closes and internally rotates my shoulder naturally. So I tend to go to that open grip just because of my shoulder position. But I never, since I've gone back to that, I've never felt like my, especially kipping stuff, is as strong as when I had a close grip. So yeah, just some different. Go ahead, Steve.
No, I was going to bring that point about internal rotation. I think that's really important. And yeah, you're not getting into too many things, but your humeral head is rotated in a little bit. Your shoulder blade can tend to come into that forward position where you're a little more dynamically impinged. And you got to make sure if you're doing that actual C grip that you, like I said, you're keeping things in a good position, because it's as much as your grip is better, your shoulder position may not be. So like you've kind of figured out, you got to modify things and just know what positions and know what grips work for you.
Yeah. And I don't know why we didn't think about this, and we're already kind of at the end, but Dave, if you can touch on this, I think would be easiest coming from your side. So we're talking push and pull, we've talked like our pushing movements and our pulling movements, but I think one of the things, especially in CrossFit, is that overhead stability, right? The old active shoulder that gets talked about all the time. So how do the push and pull muscles work to stabilize that bar overhead, whether it's a narrow grip or a wide grip?
Yeah, so the stabilization for the shoulder being such an inherently mobile joint, there's what we call this dynamic stabilization. So it's not any one muscle group. There's very much muscles on both sides co-contracting, working together. So you get your, ideally if you're holding, so think something more like an overhead squat where it's static, is you're getting this back and forth. They should both be contracting, and then some of those rotator cuff muscles, some of those muscles around the scapula are helping to pull the shoulder blade into a good position as well to help kind of dynamically do that. So that's from the anatomy stuff we're talking about. It's not an isolation thing. It's not a matter of just thinking about a certain muscle group. That's going to be really tough in a position like that, but thinking about position. So avoiding some of those positions we're talking about of not getting overly hiked up or rounded forward, not letting the elbow bend. Any of those faults in movement are going to affect how those muscles are stabilizing and shift the work from muscles to more of the stress on the joint.
Nice. Yeah, I just figured that we'd be missing something if we didn't at least touch on that a little bit. So if people had questions, they could have asked. So we'll kind of end and wrap up there. So next week, what are we talking about? Monostructural stuff, running, cycling, that type of thing. So
Yeah.
2 more weeks running, cycling stuff next week, and then the week after we will talk about the core, that big buzzword core, because that's kind of what ties everything together. Yeah, if you guys are into it, share this with your friends and family. We'll be back on next week, probably same day, same time. I'll make sure that I update and let everybody know for sure. This will get posted and live on Facebook. It'll also go on to YouTube pages. These guys will share it as well. You guys have just quick Instagram, social media, website. Steve, go ahead.
Yeah, you can find me Instagram and Facebook. If you just put in SoCal Stem Cell Doc, you'll find me on both of those. My website is actually changing in a matter of days. HealthLinkMedicalCenter.com. So all 4 words, HealthLinkMedicalCenter.com. So yeah, reach out to me and follow my stuff.
And Dave?
We're at Inside Out Strength and Performance. So we're across pretty much all channels. IOStrengthPerformance.com. That's Instagram handle as well, Facebook. And then my wife, Pelvic Performance _PT on the women's health and pelvic floor side of things, postpartum. And she'll probably be the better looking guest that might be wrapping up this anatomy series with some of the more core info that's up her alley.
Awesome, guys. Well, thank you so much for those of you that watched. Thank you for joining us. We'll do it again next week. And if you guys have anything specific you want us to hit on next week, let us know. Shoot us a message. And if you guys are watching this after the fact, comment. I'll make sure that I go on there and ask questions. And if I don't have the answer, I'll make these guys get on and answer. So thanks, everybody. And we will see you guys next week. Thanks, guys.